We proudly present 6 research papers, including 5 clinical studies published by Dr. Jessie Chung with international experts over the years in renowned medical journals. The research papers on gum disease was completed in collaboration with Dr. Rebecca Tiew and has been published in the International Journal of Dentistry and Oral Health and the British journal Mediators of Inflammation. All 6 research papers have the following features. International research. Experts from Switzerland, Russia, Italy, and Malaysia joined together for the collaborative efforts. National institutions. Research is conducted in collaboration with national research institutions such as the Dermatological Research Institute, Italy, Kabardino-Balkar State University, Russia, Russian State Hospital N1, COVID Unit, Rehabilitation Center, Dmitry Rogachev National Medical Research Center of Pediatric Hematology, Oncology and Immunology, etc. Clinical studies. The most advanced and challenging type of research in all medical reports involves the recruitment of patients from hospitals, with each step requiring collaborative efforts between hospitals and universities. High-quality research. Utilizing high-quality laboratory studies, including randomized single-center placebo-controlled clinical laboratory studies and placebo-controlled clinical studies. Peer-reviewed. Medical reports have undergone scrutiny by dozens of experts in the same field before being published. Let's take a look at 2 of the medical reports. Post-COVID periodontitis. Clinical efficacy of fermented Carica papaya L and possible mechanisms was published on July 18, 2022 in the International Journal of Dentistry and Oral Health. The incidence and severity of periodontitis after COVID SARS-2 infection are greatly increased. An open randomized case-controlled clinical trial on the efficacy of fermented papaya gel (FPG) applications into gingival pockets of patients with periodontitis diagnosed after COVID was performed. Addition of FPG to standard protocol resulted in more evident clinical, microbiological, immunological, and biochemical improvements as compared to the control post-COVID patients. FPG addition led to increased clinical efficacy due to restoration of microbiota pattern and balance between pro- and anti-inflammatory cytokines, normalization of redox balance, and MMP8. Effects of standardized fermented papaya gel on clinical symptoms, inflammatory cytokines, and nitric oxide metabolites in patients with chronic periodontitis. An open randomized clinical study was published on January 13, 2016 in the Mediators of Inflammation. The clinical efficacy of topical administration of standardized fermented papaya gel, SFPG, known to have antioxidant and anti-inflammatory properties, versus conventional therapy was evaluated in a group of 84 patients with moderate to severe periodontitis. Although not acting directly as antibiotic, SFPG acted in synergy with human granulocytes, blocking adaptive catalase induction in Staphylococcus aureus in response to granulocyte-derived oxidative stress, thus enhancing intracellular bacterial killing. Dr. Jessie Chung and Dr. Rebecca Tiew are currently continuing their research, hoping to strengthen the public's confidence in natural medicine and encouraging them to choose natural methods to improve their oral health, thereby restoring overall health.